Hello, my name is Lynn Woolley and I am Director of Maternity Services and Midwifery here at Portsmouth Hospitals. The area that we cover serves a population of 675,000 people, and at any given time we are looking after 5,500 to 6,000 women and birthing people. For most women, pregnancy is a normal part of life. But with the increasing complexity that we're seeing in our populations, we were starting to see a real increase in our numbers of referrals for more specialist things like scans or having to see an obstetrician. What happened was that the volume of referrals started to become quite overwhelming, and each of those referrals had to be managed by a person, by one of our admin team. And because of the amount of time that each of those referrals takes to process, we started to develop a really significant problem. We were having to lay on additional clinics and additional scan lists to make sure that we could safely get all of the women and birthing people to their appointments on time. And all of that just came from the sheer volume of referrals, necessary referrals that we were seeing. One of the other impacts was that our absolutely wonderful admin teams were never really feeling like they were catching up. And that had such an impact on their job satisfaction, and that impacted on morale, which in turn started to impact on attendance. We knew that we had to do something to make this better. So I didn't really know very much about automation, but I was aware that it did exist. Even though our referrals are complex and the women and birthing people, some of them that we care for, are complex, actually the referrals follow very straightforward rules. So the opportunity to apply intelligent automation just seemed too good to miss. We had to put the work in to start with in order to set up the rules, but it was time well spent, because what that meant was that when we went live with the intelligent automation and with the robot, it was very quickly able to start applying those rules. It went beyond our wildest dreams in terms of the impact that it had. And those referral numbers dropped dramatically from thousands down into hundreds. We just were blown away by that. It's been an absolutely wonderful and very educational journey for us. The collaboration that happened between all of the teams and the buy-in to make this happen, and the vision that this really was going to make a huge difference to women and birthing people, but also crucially to our teams, who were now able to move their focus onto the other aspects of their jobs and away from this endless treadmill of running to try and keep up. Now that we have understood the technology better, we're now starting to just think about other applications that this could potentially have to improve the safety of our care and also the well-being of our teams.